Okay, Mark, over to you.
Great. So my name is Mark, and I'll be talking on behalf of Mandla Health. Oh, sorry, I'm having a presentation issue. Sorry. Just a second.
Yeah, all I can say is I can relate.
Sorry. Yeah.
Had an internet connection problem. Okay,
right.
Are you good?
Yes, sorry about that. All right.
No,
so,
good. Go ahead.
As I said, my name is Mark, and I'm speaking on behalf of Mandla Health. So we are a social enterprise, and we solve inefficiencies in doctor-patient interactions. And our vision is to be ubiquitous in South African healthcare. So I saw a patient about 3 weeks ago, and he pretty much summarized the problems that we solve. So he had been diagnosed with a life-threatening condition, diabetes, about 20 years ago. And despite living with this condition for 20 years, he didn't know that he should avoid sugar. He didn't know that exercise could reverse his condition. He didn't know whether he was overweight, and he didn't know what medication he was on. And he couldn't tell me how well he remembered to take them. Now, when I saw him, he was being worked up for a stroke due to his poorly managed diabetes. And I'm sorry to say, ladies and gentlemen, but there are so many patient X's out there. We see them on a daily basis. And quite frankly, it's a public health failure. So why do we have this problem? Well, we believe there are inherent language barriers between doctors and patients, particularly in South Africa. And there are also short consultation times, which all result in poor information transfer. And then furthermore, patients also lack access to monitoring and management tools. So our solution is the Mandla Health app. It has over 40 health promotion digital booklets, multiple trackable health goals, and a medication management tool. And all of this available in English, Xhosa, and Afrikaans. So we are primarily targeting the health-conscious adult with a chronic condition and regular healthcare visits, and a need to track their health goals and medications. But in particular, we are focusing on South Africa's underserved communities. So this is our competition matrix. As you can see, many apps, health apps out there are quite good at providing health metric monitoring. But only private medical aid apps provide doctor and patient centric services. And then beyond that, most apps really neglect health education. They often don't have a medication adherence tool, and a lot of them aren't inclusive. And by inclusive, we mean that the barriers to entry or to access are still prevalent. And these barriers could be things like cost or language. So we were prioritizing stopping the hemorrhage that we were seeing in front of our eyes on a daily basis. So we don't have a strict business model, but we do believe we have some options. We believe we have a first mover advantage, and we are adamant that we'll be as free as possible for our users. And that also means removing any data costs. In the near future, we foresee a freemium subscription for both public and private health systems as a potential revenue, a source of revenue. And in the long term, we would like to provide data insights and consulting. So our pilot process is on track, and we should be starting that by the end of the year. And from this, we'd like to gather some feedback and make any improvements. And then after that, we would like to launch our app. And with our launch, we would primarily like to take advantage of our extensive networks in the healthcare system. But Mandla Health also aims to be sticky. We are targeting chronic conditions, and so we want chronic use. So who's Mandla? So Dr. Nkanyiso Hadebe is the doctor, a specialist anesthesiologist on our team. And then we have 3 fifth-year medical students with a medical science honors background, namely Gila Chora, Usiavuya Fikamba, and myself, Mark. So far, we've developed an MVP app, both on iOS and Android, and we've engaged relative prospective partners or stakeholders. And soon we'll be involving the community through the Cliptime project in Soweto, And in the future, we'd like to develop a doctor backend and many other features that will revolutionize our health system. Our business needs are primarily funding so that we can grow our enterprise and our impact. But we're also very open to any support or partnerships with regards to business model development. And that's that from us. I think I have a bit more time. So if I could just quickly ask.
Your timing is done.
Okay. I was just going to ask.
But go ahead.
Yeah, if I could ask Gilad quickly to say hi and just say what you bring to the team. And then Sia.
Hi, everyone. Thank you for having us. We really appreciate it. I'm Gilad. I'm very interested in health technologies and the intersection between that and medicine.
And then can I ask Sia to quickly say a word?
Hi, everyone. I'm Sia, and I'm involved in the content creation, language, and communication aspect of the application.
And our final team member, Dr. Nkaniso, he's busy in theatre, so I think he is listening in, but he won't be able to introduce himself. So thank you.
Nice to meet all of you. That's great. Thank you. So Precious is her first one hands up. So over to you, Precious.
Hi, thanks guys for a good presentation. I have two questions. The one is, I was wondering what the demographic is for patient X in general, and whether the language offering is adequate to service that major demographic, considering language barrier was one of the problems. And then the second question, maybe I can just give you both questions and then you can address. The second question was, with a freemium model, obviously revenues are then quite thin in that model. So what were you thinking with regards to data insights? Who are you targeting to provide those insights to? And what sort of model would you then use to generate revenues from that?
Yeah, so I think I'll answer the first and maybe the second question as well. So our patient X is generally a 50-plus-year-old living with a chronic condition, poorly informed. Often also from our experiences in the Western Cape, Afrikaans and Xhosa speaking, and so that's our primary target. And we feel that our communication and our language services are quite unique and do solve that. And then moving on to your second question, so the freemium subscription services was mainly an idea of almost setting ourselves up to become integral in any health system interaction that patients may have, and potentially leveraging that in the future. But when it comes to data and consulting, there's an ever-growing trend and need for health systems information management. And we see this in our peers that are maybe a couple of years ahead, like England or Taiwan. I think Brazil might also be on that path. But there's definitely a need to integrate healthcare and to have appropriate data-driven feedback to really get a turnaround time and make healthy decisions for our population. And bearing in mind that the NHI has been looming for quite a while, if that ever takes place, then we might be in a good position to provide services there.
Thank you, Jason.
Cool. That was a great, very super clear presentation. The one thing that I'm still a little bit missing on is, it sounds to me like there's a range of sort of somewhat key features in your offering. Is there one that you consider to be like the sort of standout feature, or like if there was one reason that I would ultimately download your app, like what would it be?
So, sorry, Sia, go ahead.
Cool. So going back to this question and the question about the demographic, if you look at our demographic, it's the health seeker, it's the patient with the positive health behavior. So now if someone wants to track their goals, want to set a goal and want to track their goals, that's a key goal, that's a key feature of the app. Also, if someone wants to actually add medication and continue with the medication as they link it to their goals, that's also a key feature of the medication of the app. And you link that to, say, a broader category of the app, which may be sexual and reproductive health. So those link together, so but the main feature being the goal in itself.
I just want to add on to that. As you mentioned, we have the booklets, the health information booklets, and we have the goals, and we have the medication adherence. And throughout the app, these sections are quite integral with one another. So with your goals, if you're tracking your blood pressure, you'll be suggested to read X and Y book about blood pressure, about smoking, about like atherosclerosis or something like that, and it will allow you to add your medication, which is controlling your blood pressure, onto that goal. So they are all quite holistic and congruent with one another.
Anton?
Thanks. I really like the presentation. I think you really understand the problem and you offer a solution. But what I really battle to understand is how you ever want to monetize what you've built. You mentioned a freemium model. You mentioned possibly selling data. I think that's going to be possibly quite tricky to sell health data given POPI Act, etc. So maybe can you just elaborate a little bit more around how you intend to monetize this?
Sure. It's definitely one of our weaknesses and something we're very open to working on. And right now, we have just started with our minimum viable product to really get an impactful base group of users. And we have many features in the future, like a doctor end of the app or a hospital end of the app that should improve the whole patient-doctor-patient health system interaction and improve efficiencies in that regard. And through this, we envisage that we could provide some form of a subscription service to, say, your private hospital groups, or even with government, and ideally government, because that's where we have a large need for improved efficiencies. I hope that answers your question.
Yeah, it seems so. Thank you. Thanks very much.
Celeste has asked in the chat if we would consider transitioning to audio, as reading may be challenging. We have considered this. We really want to not only integrate more like media services, so videos and audio presentations to the app, but we also want to expand into many more languages, which is easily done on the back end, but we just don't have the resources to make these translations yet.
Awesome. Thank you very much. Thank you. Thanks, guys. Thanks for the questions.